Good morning, everyone, and thank you for joining us. My name is Brittany Resendiz, and I am the Member Communications Coordinator at Commonwealth Purchasing Group. For those of you that are unfamiliar with our program, we are the leading group purchasing organization for community health centers and other nonprofit organizations. We're very excited to have Call for Health host our webinar on improving patient satisfaction by increasing patient access. Our speaker today is Brian Weinstein, and he is the VP of Business Development at Call for Health. Our webinar today is designed to last for 1 hour, allotting us 30 minutes for the presentation portion and 30 minutes for the question and answer portion. As you can see now, your line is currently muted. When we reach the Q&A portion, you may type your question into the question box located on the control panel, or if you'd like to ask your question over the line, please use the raise your hand option, which is also located on your control panel, and that will allow us to unmute your line so you can ask your question directly to Brian. Before we get started today, we'd like to open up a poll question. If you could please direct your attention to the screen, we will leave a few minutes for everyone to submit their responses. Please keep in mind that all answers here are confidential, and any responses that will be broadcasted following the poll question will only show the percentages. Okay, great. Now I'm just going to launch the results. And Brian, why don't we just hand it over to you now? Thanks for being with us. Why don't we get started?
Great. Hello, everybody. Thank you for taking the time out of your busy schedules to join us today to learn about how Call for Health works with community health centers like you and help with patient access and see how we can improve efficiencies within your current organization by either partnering with us or making recommendations for your current programs. So I'm going to get started here. And a quick agenda just to tell you a little bit about us and how we started, an overview of our solutions and capabilities, how we work with federally qualified health centers, who we currently work with, and why our partners choose Call for Health. To give you a little bit of background on Call for Health and how we started, we've been in business now going on 20 years, and our founder and CEO, Joseph Porras, was not in healthcare originally. He was a restaurateur and was forced into healthcare by being challenged to be a caregiver for his mother who was diagnosed with terminal cancer. Throughout the process of hospice, home care, meeting with providers, durable medical equipment companies, he was being told constantly that, you know, here's our card, you can call us 24 hours a day, 7 days a week, we're here for you to support you during this time, during this difficult time. So in the middle of the night, it was about 3 o'clock in the morning, his mother's respirator stopped working, and he pulled out the card, called the number for the provider, and the provider's office didn't answer. It went to the answering service, and the person who answered the phone said, "I'm sorry, this is just the answering service. You'll have to call back when the office reopens." So as you can imagine, during a distressful time, having to take his mother to the emergency room instead of the provider being able to help them through the process, he had went into the office the next day to say, what's going on? I was told that I can reach you 24 hours a day, that someone will be there to help me, and that is not the case. And the doctor said, well, I'm sorry, that's just the answering service. So as things went on and the communication stayed the same, nothing improved, and she had passed on, he had made it his mission and vision to change communication in healthcare so that no matter what time of day it is, what day of the week, you can reach your provider and you can get the service or solution that you're looking for, whether that be to make an appointment, whether that be to get a prescription refill, or simply just to ask a question. So now we are here 20 years later, still with the same mission and vision. However, we're more focused on patient access than we've ever been, working with federally qualified health centers. A little bit about my background. I as well have been in this industry for 20 years. I've been with Call for Health now for 6 years, all within the medical call center arena. Worked in every area from on the ground taking calls all the way through account management, programming, billing, and to where I've been today, which is in business development and contracts and compliance, where I've been in this position now for the last 6 years. So currently we work with about 125 federally qualified health centers and community health centers across the country. We handle several million calls a year. We have multiple programs, whether it be for dedicated agents that are only assigned to one federally qualified health center and shared agents that help out with maybe 3 or 4 smaller calls at federally qualified health centers that may only need us for after hours and nurse triage support. We're 24/7, 365. We have bilingual and multilingual call center solutions, English, Spanish, Creole, Chinese, Mandarin and Cantonese, Greek, and Russian. We're always expanding our language capabilities based on our clients' needs, and in the event that we do not have a language that a particular caller is speaking, we utilize a language interpretation company, whether it be ours or our clients. We have 2 facilities, both proudly and exclusively in the United States, one being in Delray Beach, Florida, where we have 250 seats, and the second in Baltimore, which is 50 seats. We work with every telecom provider out there, and the technology that we have in place in our call center, we are always improving, always adding and customizing to solutions to save time, money, and ensure patient satisfaction. So when it comes to your call center and our call center, these are the 3 areas that we represent, where it's customer acquisition and loyalty, customer value and growth, and revenue optimization. I'm going to start with customer acquisition and loyalty. The top 5 that are in red are appointment scheduling, reminder and confirmation calls, remote switchboard and remote operator, nurse triage, and emergency backup disaster recovery support services. The reason why I highlight these 5 here is these are the ones that are most commonly used by federally qualified health centers. The others that are listed below can be utilized, however, it's not common. We have some that use our patient satisfaction surveys. We have some that have seminar and events within the health centers that we register for. But for the most part, appointment scheduling, where we're interfacing directly with your EMR and practice management system, reminder and confirmation calls, which for our solution for reminder and confirmation calls, it's a little bit different than some of the ones that are out there. We connect the confirmation calls to one of our live representatives. And in the event someone needs to cancel their appointment, instead of giving that patient the ability to just opt out and not have to have an interaction, and any cancellation or reschedule calls go right to a patient care representative who can reschedule that appointment directly on that call. So what that does is it will remove that patient from that slot, which is probably the next business day at 9 a.m., and give an open availability for somebody that calls the next day with an urgent appointment, where in most cases, if you're not using our services, what happens is that slot is still full because the report that comes over from the current company either one hasn't been received, Two, hasn't been looked at to go in and remove those patients from those slots. And then that turns into a no-show and a missed opportunity to fill a patient slot, where with our solution, we remove that patient at the time of the call, we reschedule that patient so it stays on the books. So now you have a patient appointment that stays on the books, as well as the potential to add additional revenue by scheduling a same-day urgent appointment that typically would have been classified as a no-show. Our nurse triage solution is another common solution that we provide, where our registered nurses are triaging patients both during the day and after hours. We are documenting those encounters directly into the electronic health record and the patient's chart, so that you can, so the providers can see exactly what's happening on each and every nurse call. With appointment scheduling, we follow all the same guidelines that are currently being followed, whether you have a call center, a centralized call center internally, whether you have a call center at each and every location, or even if your front desk staff is scheduling appointments, we'll be following the same protocols that they follow. But what we do is we build those protocols into our scripting software so that our representatives have everything at their fingertips. Dr. Jones likes his appointments scheduled this way. Please don't schedule any appointments after 2 p.m. on Fridays. Don't book 6 family members back to back. You know, those things that a person at the front desk or even in the internal call center may have in their head, we take all of that and we put it on the screen so that the representative has that information right in front of them. And then after 90 days, we sit down and we talk and we look at the current process and procedures, and we make some recommendations for best practices to improve efficiency, increase revenue, and reduce expenses. Customer value and growth. This can be utilized for federally qualified health centers. It's not something that is commonly used. I certainly recommend it if you are doing any marketing in the community, on the radio, billboards, TV, any of those things, and you have a phone number there. It's important that you are tracking that media to determine if it's effective, if it's working, if you're getting traffic for those things. If you're spending a lot of money on TV, you want to know that that's where your traffic is coming from. With our marketing programs, we give you a number that you can utilize on those different areas so that we can determine what's working best for you. We had one client that sticks out in my mind right now, where they spent $100,000 on outdoor advertising. They spent $100,000 on TV commercial, and they spent an equal $100,000 on radio commercials. They got 0 calls from their outdoor media campaign. They got majority of their calls from the TV campaign, and they got half the amount from radio. So what seeing our reporting did for them, it gave them the ability to say, okay, we're going to reduce our outdoor budget, we're going to increase our TV, we're going to reduce our radio, and increase the TV, because that's where most of our traffic's coming from. So those are things that we can help you with. Cross-selling and upselling services based on demographics. This is something that several of our federally qualified health centers are doing right now, where if a patient calls and they're making an appointment for medical, and we offer dental services at the end of the call, we ask the patient, you use this for medical, do you use this for dental? Would you like us to schedule an appointment for you to come in for a cleaning? Things like that we can add into our script, which is going to potentially increase revenue. This point is really important, because if you have a patient base of, let's just say, 5,000 patients, and you're not offering dental, there's a great opportunity to add a dental program and have a direct source of potential revenue simply by adding in a question to your current call center process. Revenue optimization. For those of you that have people at each of the centers answering calls at the front desk, or anyone that picks up can schedule an appointment, by centralizing scheduling, it's going to, if you have 10 centers and that's 10 people that are scheduling appointments, for the volume that is coming in for all of your 10 centers, you may need only 5 people. So from a revenue standpoint and a expense standpoint, you can reduce that expense by centralizing things and having 5 people to handle scheduling and reducing some of the staff in each of your locations. In addition to that, with those of you that may have mini call centers in each one of your locations, similar concept where if you have one centralized call center for all of your appointment and some of your other billing, prescription refills, those types of calls, it's going to make things more efficient, it's going to reduce expenses, and it's going to improve the patient experience. Decreasing of no-show rates, I talked a little bit about that in the first slide, where we can decrease no-show rates by having the patient automatically connect to one of our patient care representatives, removing that cancellation at the time of the call rather than having to wait for a report. So that helps reduce no-show rates significantly. And also making a reminder call and text. We do a 7-day reminder so for those patients that need to organize transportation. That 7-day reminder is a great thing for those patients. Then we do 48 hours, another reminder, and then we do a text message the day before the appointment. So you could never, the cost for reminder calls is not that much. It's something that is simply reminding somebody of an appointment, and they show up for that appointment. That $125 of revenue that was generated for that appointment is enough to pay for the entire reminder call solution for a month. I'd like to talk a little bit about our people and some of the things that we look at as an organization. We have what they call patient care representatives. Some people call them agents, operators. We call them patient care representatives because they're affecting patient care. They're making sure that patient gets the appointment that they need. They're determining if the patient is not feeling well so that they can direct that call to a nurse. They go through assessment testing and certification, and they have medical training in medical terminology. About 90% of our staff have a healthcare background, whether it be that they've worked in a doctor's office or still work in a doctor's office, hospital, home care, going to school for nursing, medical assistance, things like that. We utilize a workforce management tool that provides us with the most efficient scheduling based on historical call volume. It takes a number of things into account, like abandonment rate, average speed of answer, average handle time, total calls, and it goes hour by hour, and then it tells us how many people we need to satisfy the service level agreement. We have a performance improvement program that we utilize in our quality assurance department where no agent on the floor is under 90% performance level. If they are, the agent goes through a closer monitoring phase. They are removed from the floor to do additional training, and then in the event that they can't bring their scores up, they are removed from the program. Right now, our average performance rate is 96%. and that's across the board on an entire organization. We strongly believe in performance improvement because there are times where someone may make a mistake, but as long as they can learn from it and improve, that's what we're focused on. We're focused on improvement so that representative gets better. And in collaboration, we work with our clients and partners on a regular basis to ensure that we're meeting all of your expectations. We provide you with access to our portal where you can listen to a selection of calls. Our QA team will listen to the same selection of calls, and we will both grade those particular calls utilizing our assessment tool, and then we'll collaborate to see if there's any areas where you graded our staff differently than we did, and then we can elaborate on that and make sure that we're assessing calls in the way that you would want us to assess them. Performance goals. Talked a little bit about our workforce management tool and scheduling based on historical call activity and being able to forecast for any potential growth or increase like back to school or flu season. Those things are all taken into account to ensure that we are staffed appropriately. These are the areas within our service levels that we have in our contracts, and we're currently exceeding industry standards across the board. First call resolution. This is something that we track that most call centers don't track. 95% or greater. Right now, we're at about 99% on all of our patient access programs for first call resolution. An average time to answer. You are having a great day if your average time to answer is 45 seconds or less. Right now, we're at about 12 seconds. 85% of your calls in 20 seconds or less, you would be thrilled. Most call centers that we see out there are 80-30. That's the trend that we've been seeing. So right now, we're at about 88 in 20 seconds. Abandonment rate of less than 5%. That is what most call centers would dream of having, especially on a Monday. Have an abandonment rate of less than 3% is something that call centers would dream about. And being able to report on all of these measures real time. We provide a reporting tool that all of our clients have access to be able to see what's happening, what the service levels are, to ensure that we're meeting the expectations outlined in the contract. Okay, I'm going to just pause on this slide for one moment, and I'm going to bring you over to see what our reporting and what our monitoring tools that we use look like. One moment while I pull this up. Okay, so what you're seeing now on the screen here is this is our web portal, and in here you can listen to recordings simply just by clicking on a button here. Hold on one moment. And it brings up a listing of the calls. I'm not going to play any calls here because again there is some, there would be HIPAA information on there, but you would have access to your calls right through this web portal. Clicking on here, the recording would be highlighted, and then in addition to that, underneath here is the screen capture so that you can see exactly what the representative is doing on this call. You can see where they're going to schedule that appointment. You can see the information that they're capturing. You can see everything that the representative has done on that particular call to ensure the quality is top-notch and that you're getting everything that you anticipated. The next area that I would like to show you is our performance metrics reporting and call detail report. These are what our clients use to determine the return on investment, to understand exactly what is happening on the calls on at a summary level. So I'm showing you first our performance metrics report. The performance metrics report is real time. You would enter the dates and times that you want to see information for. And if you have your own call center currently, these are things that should be monitored regularly to ensure that your patients are getting the experience they deserve. If you have some challenges with reporting, that's something that I would always recommend focusing on, because that's how you can track, measure, and monitor the performance of your program. As a partner of Call for Health, these are provided to you at no additional cost. This is included in the program. So whether it be we're helping you on an overflow basis to help during those peak hours on Mondays and Tuesdays, Friday afternoons, or simply to improve the answer time. If someone waits more than a minute, it rolls over to Call for Health so we can support you. Any call that we process, you would have this reporting, and you would be able to see how we are performing. And you can use that on the back end if you don't have that reporting capability to see, okay, if we set the threshold for 60 seconds, this is how many calls rolled over 60 seconds. And if you know how many calls you handled internally, then you can make some assessments from there. It's not the perfect solution, but again, it's still something if you don't have anything. So this shows calls offered, abandoned, number of calls answered, what the percentage of abandon is, how many call-outs, non-live calls, how many calls we connected back, your average handle time, your average time to answer, 34 seconds, the service level, so 85% in 30 seconds or less, number of calls that were scheduled, percentage of calls to appointments, and here's where this is the most important part here, right down here. Estimated Call for Health cost for this amount of calls. Potential revenue generated is this number here, the 7,200 appointments, times $120 per appointment, which is the average reimbursement rate amongst FQHCs, and multiplied by a 50% show rate. Now, if you had a 50% show rate, that's something where our no-show application, our appointment reminder application would significantly help. But I didn't want to put that at 20% no-show rate or an 80% show rate, because the number would be even higher than it already is. So what you see here is that the revenue generated was $432,000, and $129,000 was spent, $432,000 was generated, and that's a return on investment of 234%. And this is only for 1 month. So our programs are paying multiples of 234% for the return, which is there aren't many banks that are going to give you 234% return. But this is something, if you're measuring and monitoring the performance of your call center, these are things that you can prove the value and concept that it makes sense to ensure that your patients can access your health center whether it be 24 hours a day or whether it be 12 to 15 hours a day to schedule appointments. Healthcare is one of the only industries out there where you have your clients calling you to use your services. And it's one of the only industries that has the most challenges with that task, which is answering the calls and scheduling appointments. And that's how we can help you and partner with you to ensure that your patients can access your health system 24 hours a day, 7 days a week, 365 days a year. We talked also about the data and the reporting call detail. So this is a report that takes this information and gives you the actual data that was captured so that you can see what calls are coming in and what's happening with each of these calls. And you can make some decisions on what the next step would be, whether, take a look at prescription refills and medication. We got 857 calls. It's only 3% of the call volume. Does it make sense to staff someone internally to handle just prescription refills? And we task those in right back to that person to handle it. Doctor-to-doctor calls, lab test results, facility provider appointment request, patient condition, debating going to the ER. Again, all of these things are captured in the script. What specialty patients are calling for. This is a great opportunity for this particular client that we're working with. You have 14,804 adult patients calling in. These 14,804, you're not offering dental. It's a simple cross-sell to offer them dental to see if there's an interest before you even build it into your current infrastructure. The locations, broken down, which location's getting more calls. The appointment types. So this is something where we work with our clients to streamline appointment types. Having 15 to 20 appointment types is probably not ideal. 5 or 6 is what we recommend. And again, having the data to be able to make those decisions and determinations is critical. And I'm not going to go into detail on that page, but the next page would be all of the raw data where it has the patient information so that you can look and see what patients are calling in and all of that stuff. It's your data. It's the data that is going to help you make decisions, help you track, help you determine what revenue is being generated. Okay, so I'm just going to finish off the presentation with talking about how we work with you and who we work with. So how we work with you is we determine what program you would like to work with us on, whether it be helping on an overflow basis on Mondays, Tuesdays, and any of those busy hours, whether we're doing after-hours answering service with nurse triage, appointment confirmation and reminder calls. We would determine what that is, and then we have this implementation methodology that we use. We have a kickoff call, which is we introduce the entire team to you, your account manager, who's overseeing the project, business development, client relations, IT, system support, developer, who's going to work on you throughout the project and bring us to the design phase where they're going through all of your expectations, all of your requirements, and building that scripting, application, and reporting to determine, to make sure that we're, again, meeting all your expectations. Then we bring it into our training area. Our training department then assesses the program, they review the call flow, they review the entire script that was built, and they work with the team leads on the floor to ensure that they understand the requirements and they understand everything that was reviewed with the client relations manager as well as the project manager and trainer. The team leads and the training department then go into the testing phase, where they test everything that was programmed. They test each and every representative to ensure that they are familiar with your account, that they are they know how to log into the scheduling application, they know how to schedule appointments, they know all the protocols and procedures. And then after the testing phase, we schedule a go live with our partner that works with you, where we're going to do some mock calls, and once those mock calls are approved, we pick a date that we're going to turn the line on and move forward. That process, depending on the size, depending on the number of representatives that we need to train, can take anywhere from 6 to 8 weeks. And who we work with. Currently, our customer base consists of community-based health centers or federally qualified health centers, hospital and health system networks, home care and hospice agencies, and pharmaceutical companies. Currently, the top 2 community-based health centers, FQHCs, and hospital and health system networks represents 80% of our organization, where home care and hospice agencies and pharmaceutical companies represent the 20%. And these are some of the federally qualified health centers that we currently work with. Certainly not all of them. I couldn't fit them all on the screen, but I wanted to highlight a few of our current partners. Anxieties versus reality. This is, over the 20 years of doing this, these are 3 of the most common questions that, or things that are posed to us about partnering with a call center. When it comes to cost, outsourcing can't possibly be a less expensive alternative. But when the reality is, Call for Health, we guarantee cost reductions. When it comes to quality, no one can know my business or customers as well as I do. In reality, Call for Health will provide a team of experienced, industry-specific professionals to better manage your program, to give you the tools that you need to succeed. And when it comes to control, if I outsource my care, I lose control of my data, ability to anticipate my customers' wants and needs. As you saw in the presentation, the portals that we provide access to, the reporting capabilities, Call for Health is going to give you program management through technology and accountability based on our experience. We're going to give you access to listen to your calls. We're going to give you access to the reporting tools so that you can track everything that's going on. Most of our partners, before coming to us, don't have all of the capabilities to listen to calls, to track day-to-day what the call volume is, and drill down on all of those areas that I showed you earlier. So Call for Health at no additional cost provides you that, gives you those capabilities. And at the end of the day, we want to help you meet your organizational goals. We're not one size fits all. It doesn't have to be done this way for every single client. We can customize our solutions to meet your needs. We can scale up, we can scale down, we can help you in any area that you need. We make it simple. You get an immediate ROI, as I showed you, through our reporting capabilities. We remove the complexity of day-to-day management, and you have a built-in scalability, redundancy. And redundancy is real important these days when there's power outages or weather issues. You know that you have a call center who's redundant, that has multiple locations to ensure that we're always up and running during your time of need. Security, hosting, IT expertise, HIPAA compliant, all of the above. So that takes me through the end of the presentation here, and I'd just like to say thank you for your time. Here are some key takeaways that, if anything, we have a number of solutions available to help your organization, and you don't have to utilize everything. You can utilize 1, 2, 3, all of our solutions. We have a strategic partnership with Commonwealth Purchasing Group, which gives you the lowest rates, extremely discounted pricing on all of our services. So thank you.
Great. Thank you, Brian. At this time, we'd like to open it up for questions if you have any. Brian, we did receive one question that came through while you were presenting, so I didn't want to interrupt. But the question came from Randy Tolliver, and he asks, what skills / capabilities does Call for Health's internal performance improvement process measure?
Okay, let me show you. Okay, so here's the areas that our QA team assesses. And we're monitoring 5 calls per agent per week, and we currently have 235 agents and 60 registered nurses. So we have 8 full-time quality assurance specialists and 1 quality assurance manager. So 8 total people, or 9 total people now that we actually added 1. So we have 9 people full-time, 8 hours a day, listening to calls and grading on these areas where we have the warm greeting, identifying the need or problem, verifying information to ensure accuracy, service mentality, being engaged with the caller, positive language, using transitional statements, positive words, being prepared to take the call, sound like an advocate, compassionate, empathetic, taking control of the call. As some of you may know, when patients call, depending on the patient, they can ramble, go off on tangents. It's being able to control that call, ensure that we get the patient what they need in an efficient manner, and that there's no long periods of dead air. Language, no slang words being used, saying please and thank you, following the script, scheduling the appointment correctly or as tasking appropriately, follow the payment insurance protocol, recapping of the appointment or the message, and using the appropriate closing. So as you can see here, you have on our side 95 to 100% is exemplary, 90 to 94% is compliant, and below 90% is non-compliant. And these are, if someone's non-compliant, they put the notes here, what the performance improvement plan that's assigned, what the trainer's comment is, and this is all tracked and documented and reported back on a regular basis. So did that answer your question?
I think so, yes. Thanks, Brian, for going through that. It looks like we've had a couple more questions come through here as well. Debbie Williams asks, which EMR systems do you have experience with?
We have experience with Epic, NextGen, eClinicalWorks, Centricity, Allscripts, MyWay, Misys, Those are the most common ones that we're currently using. But what we have found is that, the EMR and practice management system, they're pretty similar. What changes from system to system is actually the templates that are designed by the organization. So we're pretty familiar with most systems that are out there, and it's a matter of making sure that the templates are effective and we can understand them to ensure that we're processing calls correctly.
Okay, great. I just wanted to add for everyone who's still on the call that we will be mailing a recording of today's presentation to everyone tomorrow. And if you're interested in receiving an actual PDF of the slideshow, please let me know and we can also send that to you personally if you would like that as well. Brian, is it possible to talk a little bit about the pricing structure, or is that something that you'd rather connect personally with anyone on the line about?
Yeah, because it's on a case-by-case basis, because we do have plans that are associated to each based on volume, so it's better to go through a case-by-case.
Okay, great. All right, it doesn't look like we have any other questions here, but we do still have some time. If there are any last minute questions that need to come through, if you'd like to ask Brian, or if you feel more comfortable reaching out later on, his email address was located on the first slide, which you will receive tomorrow, or you can reply to the invitation that was mailed to you via email, and we can connect you with Brian directly. Okay, great.
That's good. Yeah, put it back up there.
Perfect. If you'd like to jot down Brian's information now, if you'd like to reach out to him directly, I will share those attendees on the line who are interested in a pricing structure directly with Brian, so he'll be reaching out to you. And if you have any other questions, please feel free to reach out to us here or to Brian. Thanks, Brian, for being with us today. We really appreciate it, and we hope everyone on the call found it to be very informational and beneficial.
Thank you very much. Have a great day.
Thanks, Brian. Thank you, everyone. Enjoy your day.
Thank you. Bye-bye.